In this video, I'll outline how to use the Nasal Inspiratory Peak Flow meter, also known as the NIPF. NIPF is a semi-objective measure of nasal airflow, and it is useful for both pre- and post-operative assessment of the nasal airway, particularly in distinguishing from mucosal and structural causes of obstruction, and in quantifying improvements after surgery. One of the most useful functions of the NIPF is guiding surgical decision-making. For example, a patient with a poor baseline NIPF that improves significantly with decongestion may be an excellent candidate for turbinate reduction. Conversely, a patient with persistently low values despite decongestion may point towards a structural cause requiring perhaps a septoplasty or combined intervention. Conversely, a patient may present with cosmetic concerns and a deviated septum, but may record normal NIPF values. This discrepancy suggests that surgery is less likely to provide meaningful functional improvement, even if the septum is straightened. In such cases, the discussion can be reframed around expectations, risks, and potential cosmetic rather than functional benefits. It is important to emphasize that NIPF should supplement rather than replace a complete clinical history and examination. In my practice, I also combine it with a validated patient-reported outcome measure, such as the nose score, to capture both patient-reported and semi-objective measures of nasal function. The NIPF meter consists of a reusable device and an attachment for a disposable face mask. The meter lasts up to 2 years before a replacement is required, and a viral filter prevents cross-contamination. The face mask should be changed between patients, and for most, a size 4 anesthetic face mask is sufficient. In order to test, the patient should stand upright and exhale fully, before placing the mask securely against the face, ensuring an airtight seal. They must inhale as quickly and deeply as possible before removing the device and returning to normal breathing. The meter is reset by a brisk tap which releases a weight that returns the meter to 0, before inverting the meter to return the magnet to the top. The key points to remember are that the patient must breathe through the nose only, the seal should be airtight to prevent leakage, and the mask should not press on the external nose, as this may compress the lateral cartilages and give a falsely low reading. After 3 recordings of the bilateral NIPF were completed, a small piece of adhesive tape should be applied to occlude one of the nostrils, and the process is repeated. This allows unilateral measures to be recorded. After recording bilateral and unilateral reading, a nasal decongestant is applied. The test is then repeated after 5 to 10 minutes. NIPF is considered semi-objective as it depends on patient effort. Forced inspiration may induce internal nasal valve collapse, even in asymptomatic individuals, but application of the mask against the face results in a modified Cottel's effect which negates this. NIPF is therefore not ideal in detecting obstruction secondary to weak upper cartilages. Interpretation of bilateral results is as follows. A normal score is considered over 120 liters per minute. Mild obstruction is indicated by a score of 80 to 120. Moderate obstruction is a score recorded between 50 and 80 liters a minute, and a score less than 50 liters per minute indicates severe obstruction. A calculator is available on entcalculator.com to help interpret your results. NIPF is quick, reliable, and a worthwhile addition for assessing the nasal airway, particularly when combined with patient-reported outcome measures, clinical findings, and examination. This can help you guide surgical decision-making in order to decide the best course of action for your patients.